What if I told you there is a biological loophole that allows you to flood your face with the collagen boosting power of youth without a single drop of it entering your bloodstream to affect the rest of your body? For decades, women have been handed a terrifying ultimatum. Either take systemic hormones that affect your heart, breasts, and brain just to keep your skin young, or simply watch your face collapse as menopause sets in. But that is a false choice. You do not have to treat your whole body to save your face. We are talking about a specific insider prescription mechanism that stays exactly where you put it. It is the difference between flooding your entire house just to water a single plant in the living room and simply using a targeted watering can. Today, we are going to explore the science of the local loophole, a method that essentially tricks your skin cells into thinking they are 20 years younger while your bloodstream remains none the wiser. By the end of this video, you will know exactly what to ask your doctor for to stop the menopause melt in its tracks safely and effectively. Before we dive into this science that could genuinely change the way you age, I want to invite you to join our community. Consider subscribing to our channel because we are dedicated to sharing the kind of senior health tips that mainstream doctors often overlook in the rush of a 15-minute appointment. We are here to empower you with knowledge. And while you are getting settled, let me ask you a quick question to kick things off. Where are you watching from today? And have you ever felt that your skincare routine just stopped working overnight? Let me know in the comments below. I love seeing how far our community reaches. Now, let's get into the heart of the matter. To understand the solution, we first have to understand the collapse. When we think of menopause, we think of hot flashes, mood swings, and sleepless nights. But one of the most significant, yet often dismissed symptoms happens in the mirror. It turns out that your skin is not just a covering, it is an estrogen responsive organ. Your face is literally packed with estrogen receptors, specifically beta receptors, which are like tiny locks waiting for a key. When estrogen is flowing, it unlocks these cells and tells them to produce collagen, the protein that keeps your skin plump, and elastin, the protein that keeps it tight. But when estrogen levels plummet, those locks stay closed. The result is startlingly rapid. According to a seminal study published in the International Journal of Dermatology, women lose approximately 30% of their skin's collagen in the first 5 years of menopause alone. Think about that for a second. That is 1/3 of the structural support of your face vanishing in just a handful of years. It is like removing every third brick from the foundation of a house. Naturally, the roof is going to sag. No amount of surface level moisturizer can replace those missing bricks because the problem isn't dryness. The problem is the factory has shut down. This leads us to the great dilemma. We know estrogen fixes this. We know that replacing the hormone brings the collagen back, but we also know the fear. For decades, women have been terrified of hormone replacement therapy, or HRT, and often for valid reasons. We remember the headlines from the Women's Health Initiative. We worry about breast cancer, strokes, and blood clots. We think, I want better skin, but I am not willing to risk my life for it. And that is a completely rational calculation. You shouldn't have to treat your whole body, flooding your liver and heart with systemic hormones just to fix the skin on your face. This is where the insider truth comes in, the breakthrough that dermatologists are whispering about to their favorite patients. It is called topical estriol. Now, notice I said estriol, not estrogen generally. This distinction is everything. In the human body, we have different types of estrogen. Estradiol is the strong one, the one responsible for reproduction, and the one that carries more of the systemic risks we worry about. Estriol, on the other hand, is considered a weak estrogen. It is the primary estrogen produced during pregnancy, and it has a very different safety profile. Here is the magic of the local loophole. When you apply a properly compounded estriol cream to your face, it targets those receptors in the skin, telling them to wake up and start making collagen again. But because estriol is a weak hormone, and because of the way it is formulated for the skin, it struggles to penetrate deep enough to enter your bloodstream in significant quantities. A study published in the journal Menopause investigated the systemic absorption of low-dose topical estriol and found that when applied to the face, serum levels of the hormone remained virtually unchanged in the blood, meaning it does its job locally and then breaks down without going on a tour of your entire body. Imagine it like watering that single house plant we talked about. You are giving that specific plant the water it needs to thrive, but you aren't flooding the entire house or turning on the sprinklers in every room. Oral HRT is the sprinkler system, topical estriol is the watering can. You get the benefit exactly where you want it: plumper, thicker skin without the systemic flood that causes side effects elsewhere. This is the precise reason why even women who have been told they cannot take oral hormones are often cleared by their doctors for this topical approach. So, what exactly does this cream do once it is on your skin? It doesn't just sit there, it goes to work on a cellular level. We aren't talking about temporarily swelling the skin with moisture, we are talking about structural repair. One of the most compelling pieces of evidence comes from a landmark study conducted at the University of Vienna. In this study, women applied a topical estriol cream for 6 months. The results were nothing short of astounding. The researchers found that skin elasticity increased, wrinkle depth decreased significantly, and perhaps most impressively, collagen production was boosted by nearly 50%. Let that sink in. A 50% boost in the very protein that holds your face up. The study also noted that the vascularization of the skin improved, which is a fancy way of saying blood flow got better. Why does that matter? Because blood brings oxygen and nutrients. Imagine your skin is like a garden that has been suffering from a drought. This cream doesn't just paint the brown leaves green, it repairs the irrigation system, turning the soil rich and fertile again so the garden can grow on its own. Now, you might be wondering, if this is so amazing, why haven't I seen it at the department store counter next to the retinol? And this brings us to a critical point about the industry. Estriol is a bioidentical hormone. It is a prescription medication, not a cosmetic ingredient. You can shelf stabilize in a plastic tube for 3 years at a drugstore. You cannot patent a bioidentical hormone in the same way you can a synthetic chemical, which means Big Pharma has less incentive to spend billions marketing it to you. This is why the solution lies in the conversation. You have to ask for it. Specifically, you need to talk to your doctor or dermatologist about compounded estriol face cream. Compounding is the art of creating personalized medicine. A compounding pharmacist takes the raw, pure estriol powder and mixes it into a high quality cosmetic base cream that is perfect for your skin type. This isn't one size fits all. It is couture medicine, but let's get practical. How do you actually use this, and what should you expect? Using a hormonal cream sounds intimidating, but it is actually incredibly simple. It slots right into your evening routine. We generally recommend using it at night because your skin enters repair mode while you sleep. A study in the Journal of Circadian Rhythms highlights that skin cell proliferation is faster at night, meaning your skin is more receptive to active ingredients while you are dreaming. You would wash your face, perhaps apply a light serum, and then apply a pea-sized amount of the estriol cream to your face, neck, and crucially, the back of your hands. Don't forget the hands. They are often the first place to give away our age because the skin there is so thin. Anecdotally, many patients report seeing a difference in hydration within weeks, but the structural changes, the thickening of the skin, take time. Remember, we are rebuilding the foundation, not just painting the walls. It usually takes about 3 to 6 months to see the full wow effect, where friends start asking if you've had work done. If you are finding this information helpful so far, do me a quick favor and hit that thumbs up button. It tells me that this is the kind of deep dive scientific content you want more of. Let's address a common question. Can you combine this with other anti-aging powerhouses? Absolutely. In fact, it plays very well with others. Many dermatologists recommend using estriol in conjunction with retin A or retinols. While retinols work by turning over the top layer of skin cells, estriol works by thickening the dermis underneath. It's a two-pronged attack. A review in the Journal of Cosmetic Dermatology suggests that combining mechanisms, exfoliation and collagen stimulation, yields superior anti-aging results compared to monotherapy. It's like having a personal trainer for your muscles and a nutritionist for your diet. They work better together. However, we must have a serious moment about safety. Even though the local loophole prevents significant systemic absorption, we must always operate with caution and transparency. If you have a history of estrogen sensitive cancers, such as breast or uterine cancer, the conversation with your oncologist is non negotiable. While the data suggests safety, your specific history is unique. A consensus statement from the North American Menopause Society emphasizes that while low dose vaginal and topical estrogens have a localized effect, any hormone use in survivors should be a shared decision with a healthcare provider. Do not let this scare you away from asking the question, though. Many oncologists are now recognizing the quality of life importance of these local treatments and are open to the discussion, especially given the low absorption rates we discussed earlier. It is about weighing the massive benefits for your skin and confidence against theoretical and minimal risk. Knowledge is your armor here. When you walk into that doctor's office, you aren't just a patient complaining about wrinkles. You are an informed woman asking about a specific science-backed mechanism involving estriol. Another fascinating aspect of this local treatment is how it affects the moisture barrier. As we age, our skin stops producing as much oil and as much hyaluronic acid. We dry out like a grape turning into a raisin. Estriol actually stimulates the synthesis of hyaluronic acid in the dermis. A study published in Dermatoendocrinology confirmed that estrogen signaling is directly responsible for the production of the mucopolysaccharides that hold water in the skin. So when you use this cream, you aren't just adding oil to the surface, you are teaching your skin to hold onto water again. It is the difference between pouring water in a rock versus pouring water in a sponge. The sponge absorbs and swells. The rock just gets wet for a second. We want your skin to be a sponge. This internal hydration gives you that glow that makeup simply cannot replicate. It is the glow of biological health. Now, let's talk about the logistics of getting this. You might be thinking, my regular doctor doesn't do cosmetic stuff. That is a valid hurdle. General practitioners are wonderful, but they are often focused on keeping your heart beating and your cholesterol down. They may not be up to date on the latest dermatological compounding protocols for anti-aging. You may need to seek out a dermatologist, a functional medicine doctor, or an anti-aging specialist. When you sit down with them, here is your script. You say, I have read about the effects of declining estrogen on collagen loss, and I am interested in a prescription for compounded topical estriol specifically for the face to treat skin atrophy. Using the term skin atrophy, which is the medical term for thinning skin, shows you mean business. You are not just being vain. You are treating a medical condition of the skin. It is also worth noting that this is generally an affordable luxury. Because it is compounded, it doesn't have the markup of luxury brand names. A month's supply of compounded estriol cream often costs less than those high-end jars at the beauty counter that do a fraction of the work. You are paying for the ingredient and the pharmacist's time, not the glossy magazine ads or the celebrity endorsement. Let's recap the strategy because I want you to walk away with a clear plan. First, acknowledge that the aging you see is largely hormonal. Second, understand that you don't need to treat your whole body to fix your face. Third, remember the science. Estriol is the weak estrogen that stays local, boosting collagen by up to 50%, according to the University of Vienna, without spiking your blood levels. Fourth, find a provider who listens and ask for compounded estriol cream. And fifth, be consistent. Give it 6 months to rebuild what menopause took away. As we near the end of our time together, I want to leave you with a thought about what this really means. This isn't just about vanity. It isn't just about wanting to look 25 again. It is about alignment. It is about looking in the mirror and recognizing the vibrant, strong, capable woman you feel like on the inside. When you take control of your health, even in a matter as seemingly small as your skincare, you are sending a message to yourself and the world that you matter. You are saying that you are worth the effort, worth the research, and worth the investment. Aging is a privilege, but how we age is to a large extent a choice. You have the tools now. You have the insider knowledge that shifts the power from the aging process back into your hands. You don't have to accept the drying up narrative. You can choose to be juicy, vibrant, and glowing right into your later years. So here is my challenge to you for this week. If this resonates with you, make that appointment, start the conversation. And I want to hear from you. Have you ever tried a compounded prescription for skincare? Or is this the first time you are hearing about the local loophole? Tell me your story in the comments below because your experience helps educate our entire community. If you found value in this deep dive, please like this video and subscribe. We are building a movement here of informed, empowered seniors who refuse to settle for the status quo. And we want you with us because your health is absolutely worth fighting for. Until next time, remember, your skin is an organ. Treat it with science, treat it with love, and stay curious. You've got this.